Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will chat with Cindy Cheatham and John Tate, members of Novant Health Foundation Brunswick Medical Center, and they're going to tell us more about the upcoming hospital ball. Next, we will meet Dr. David Snow, who recently opened Cape Fear Arthritis Care. Finally, we will talk with Becky Whiteside, Novant Health OBGYN Practice Manager, about a new exciting technology that is being offered in the office. Stay tuned to learn about valuable health topics with Health Watch. Our first guests today are Cindy Cheatham and John Tate, co-chairs for the upcoming Flip-Flop Ball. Well, welcome to the show today, guys. John and Cindy, it's a pleasure to have you here.
June, thank you for having us.
Thank you.
You're welcome. Now, before we get started, tell me a little bit about your role with the Novant Health Foundation Brunswick Medical Center.
Well, I serve on the foundation board. I have been in that position since 2012, and my term runs till 2015. And John is on the foundation as well.
How long have you been there, John, on the board?
I've been there for 1 year so far,
1 year?
and 2 glorious years yet to come.
That sounds great. Well, we're here today to talk about Novant Health Foundation Brunswick Medical Center and one of its upcoming events. And I love events, so I'm real excited about this. Now, before we talk about the event, tell me what the purpose of the hospital's foundation is.
Well, June, we do 3 primary things in the community. One, we're trying to go outside the walls of the hospital in general and reach out to the community. Mm-hmm. Our mission primarily is one of raising funds to provide programming and other things at the hospital that wouldn't normally be funded. And then the final third thing is something that Cindy has worked on before, which is
probably just acting as a liaison between the community and the foundation.
Mm-hmm.
And that's one thing you do really well.
Thank you.
You also raise funds really well, too.
Yes, thank you. Thank you.
So let's talk about the projects. What projects are the foundation currently working on or planning for the future?
I think one of the main initiatives right now is on women's and children's health. That's one of the main focuses in reducing childhood obesity, reducing smoking during pregnancy, and to increase breastfeeding in mothers and new mothers.
Mm-hmm. Yeah, I've seen lots of things in the paper and what have you about those 3 programs, and all of those are very important. I know those were identified as areas in Brunswick County needing additional education, and so I think that's a wonderful thing that the foundation has targeted those areas to work on. So now I know that you're trying to raise some funds and you're going to have some events coming up, but the first one being the hospital ball. Is that correct? So tell me about that. Tell me about the ball.
Well, really, we're just trying to have an event that everybody can come, feel casual, and have a lot of fun. And I do know that Cindy is going to do some dancing, so we're looking forward to that.
And so what is this event called?
It's called the Flip-Flop Ball.
Ooh, can I wear flip-flops?
Yes, you can.
Wow.
Flip-flops are encouraged. Shirts are required. So, I mean, even some of the gentlemen you may find will even wear shorts. They might wear their khaki shorts. It's just a very a casual, fun event.
Mm-hmm. So I think I heard that it's going to be in a new location this year. Am I correct?
Yes, it is going to be at Brick Landing. It's a new location, and we think the ability to walk outside and look out over the water is really going to be a plus for the party.
Absolutely.
That's a great space. I think they recently renovated the upstairs, Cindy, am I correct?
Yes, it's gorgeous. It's gorgeous. So I think it's a beautiful backdrop for our event.
And so what will we be able to do at this event? What What's going to happen there?
Well, we're going to do a lot of dancing and some eating and some mingling and raising money. We're going to have 2 fantastic bands that we have the privilege to have. We're going to have a beach music band, Sea Cruise, which they're very well known in the area.
Wow.
And then we're also going to have a steel pans band called, or a steel drums band called Steel Pans. And that'll be a lot of fun as well. So it'll be a really nice, fun event.
Now, I don't think we said the date, John, did we?
We haven't yet, but it's going to be May 31st at 7 p.m.
May 31st at 7 p.m. Again, it's at Brick Landing. Well, that is just around the corner, right? Am I right?
It's coming right up on us.
Now, Cindy, you mentioned the 2 bands. I think it's Sea Cruise and Sea Pans.
Correct.
Tell me a little bit about those bands. What kind of music does Sea Cruise play?
Okay, Sea Cruise is a beach music band. They're local band. I consider local here in North Myrtle Beach. They play all over.
Oh, good.
But they're fabulous. They're a lot of fun. Just 3 people in the band. And they really interact with the crowd and play a lot of good fun music.
That'll be great. And how about Sea Pans? Tell me about them, Cindy.
Well, they're a steel drum band that's coming out of Wilmington. They're fabulous. It has a Caribbean feel to it. So they'll probably be playing when you enter the event. So it'll really set the tone for the whole night.
Oh, that sounds like fun. That sounds like fun. Well, so how many people do you expect to have at the event? Are you expecting 300 or?
Well, we'd like 10,000, but I think we'll shoot for around 300 people.
Yes.
And what else can the folks expect to see at the event? There's going to be great food and
wonderful food.
Yeah,
wonderful
hopefully
food.
a little bit of everything. People in flowered shirts, leis, things like that. Just having a lot of fun.
Yes, and we had the privilege of having a little sample tasting prior to kind of help decide on that menu, and I can promise you it's going to be delicious.
Good, good. So how much are the tickets, and how would our viewers go about getting those tickets?
Well, tickets are $100 each, and there are sponsorship opportunities available for businesses and other organizations who would like to sponsor this event.
Right.
And is there a phone number that we can call for tickets?
Yes, you can call 910-721-1460.
1460, okay. And then we'll run that as a trailer along the bottom so folks will know how to get in touch with you. Well, that sounds like a lot of fun. And I understand that you have a couple of other events scheduled for this year in terms of fundraising. Let's talk about those a little bit.
Yes, we do. We have a golf tournament coming up in September. It's going to be held at Lockwood Folly. I believe the date is September the 19th. And then on November the 1st, we have Glitz, Glamour, and Glow. So this will be our second year doing that. Last year was our inaugural event, and it was very successful.
I went to Glitz, Glamour, and Glow. It was amazing.
It was. And this year it's going to be held at the same venue at 101 Stone Chimney Place. Okay,
that's great. And you said the golf tournament is where?
Lockwood Folly.
I think it was there last year.
I believe
am I correct?
Right. Yes.
Yeah, I think that was very successful too. Yeah. Well, I think that's about it for today. Is there anything else you guys can think that we need to add?
Just call the 721-1460, purchase your tickets, and come to an event that we know will be a lot of fun because we've put a lot of work into it.
Yeah, it's going to be a lot of fun.
It sounds like it. I hope you have great weather.
Yes, me too.
And I hope it's very successful for the foundation. And thank you guys for all that you do on the foundation. That's a very worthwhile organization, and I know that the hospital is very appreciative of the time that you devote to the foundation. So thank you again.
Thanks,
Thank you.
You're welcome. Our next guest today is Dr. David Snow. Welcome to the show today, Dr. Snow. It's such a pleasure to have you here.
Thank you for having me, June. It's a pleasure to be here.
Thank you. Now, I understand that you recently opened a new practice, so tell me more about that.
We are really excited about opening a arthritis practice to service the Cape Fear area. We're going to be just outside of Brunswick County near Delco, North Carolina.
Right. And that's on 74, is that correct?
On 74, yes.
Yeah, wonderful. So I know you're a rheumatologist.
Yeah.
And so let's talk a little bit about what that is. What really does a rheumatologist do?
Well, that's a good question because many people don't know what a rheumatologist is. And actually, when we formed the name, we decided it would be better to be Cape Fear Arthritis Care rather than Cape Fear Rheumatology. But rheumatology is basically the medical management of aches and pains. We are non-surgical, and we deal with all types of aches and pains from inflammatory arthritis to degenerative arthritis to bursitis to tendonitis to pain management, pain perception syndrome. So really kind of cover the gambit of aches and pains medicine.
Mm-hmm. I'm curious, was there one particular thing that helped you choose rheumatology?
I worked with Dr. Crone in my residency at Allegheny General in Pittsburgh, and he was a rheumatologist, and he kind of sparked my interest. I've always had an interest in musculoskeletal medicine, and just working with him kind of gave me an outlet for that. The other option for musculoskeletal medicine is surgery, and I'm not very surgery doesn't excite me. So it was good to have to move in a direction as far as musculoskeletal medicine, and really help people with aches and pains. I really enjoy that.
Mm-hmm. Now, you said you did your residency at Allegheny General in Pittsburgh.
Yes.
Where did you go to medical school?
I went to medical school at the University of Toledo in Ohio, Medical College of Ohio. And then the residency at Allegheny General and my fellowship at the University of Pittsburgh.
Good credentials.
Yeah, thank you. Thank you.
So what would be some of the most common conditions that you treat?
We treat all kinds of things that cause aches and pains. We treat osteoarthritis.
Okay.
I usually divide things into three broad categories of things that cause aches and pains. There's inflammatory arthritis, which is rheumatoid arthritis, lupus, gout, psoriatic arthritis, and these are conditions where, for one reason or another, there's inflammation in the joints. Then there is osteoarthritis, or wear and tear arthritis, where there's breakdown of cartilage and the joints are breaking down. Unfortunately, the only way to fix that is surgery, but we can help people live with it better. And then the other broad category is pain perception issues, things like fibromyalgia and myofascial pain. We help patients with those as well.
I'm curious, talk to me a little bit more about rheumatoid arthritis. I hear that term all over the place. So, everybody says, oh, I have rheumatoid arthritis. And I have arthritis in my knee, but it's just regular arthritis. And so what's the difference between that?
Well, that's a very good question. We get that a lot. Is many times I'll have a patient come in and says, my knee hurts. Is that arthritis? And we need to get into a little bit more there. One of my pet peeves is a patient goes to the doctor and says, my neck hurts, and the doctor does an x-ray and says, you have arthritis, and the patient leaves. And that really doesn't do a good service for the patient, because as we get older, we get wear and tear changes that show up on x-ray. But that doesn't necessarily mean we're going to have pain from them. The arthritis was there 2 weeks ago, but the pain started a week ago. So there's some dynamic there. And rheumatoid arthritis is one of the inflammatory arthritis. It's an autoimmune disease where the immune system is affecting the joints. So you get inflammation, swelling, there's signs in the body that the immune system is activated. And it's actually the inflammatory arthritis category is the conditions that we can do the most about. Those are probably the most satisfying conditions to treat. They do require medications to control them, but we can actually do something about what causes the arthritis. Where the other two categories, it's a little bit hard to do anything about what causes the arthritis. It's more of learning to, or working with improving symptoms, but not changing the process.
Well, let's talk about treatment a little bit. How would you treat one versus the other? What would be some of the common treatments?
For inflammatory arthritis, we use things that calm down the immune system. Initially, sometimes prednisone, and that is a dirty word. I understand that. Everybody likes to stay away from prednisone, but using it judiciously and carefully, it is a very good tool, and it has less side effects than Motrin and the anti-inflammatories. And then we move into medications that slow down the immune response. And many people have seen the ads for Enbrel So those are medications for inflammatory arthritis. Gout is something that we see a lot of. And it's kind of a fun condition because it's such a straightforward condition. It's one of the easiest things I do, but it's one of the things that can be
You get that in your big toe, right?
That's where it can start, but it's not, doesn't mean, you know.
Oh, okay.
Yeah, 50% of the time is there at presentation, 80% of the time at some point they have it in their big toe, and not all big toe pain is gout. And that's another thing that, you know, because it's a very common place for osteoarthritis as well. For osteoarthritis, the wear and tear arthritis.
Yeah, I'm most interested in that.
Yeah. Well, it's really exercise is very important. Strengthening muscles, staying active. Yeah, and not, you know, knees are very common, and you know, the one thing that nobody wants to hear is weight loss. But the knees see 4 times the body
Now,
weight.
wait a minute. Are you saying I need to lose weight?
I was talking about people in general. The knees see 4 times the body weight. So if you lose 10 pounds, it's 40 pounds off your knees. If you lose 20 pounds, it's 80 pounds off your knees. Yeah. And that is the biggest risk factor for osteoarthritis in the knees, and the thing that can make a big difference. Another, we try to get patients into an exercise program, strengthening the quadricep muscles, help to stabilize the knees. We use topical agents, anti-inflammatories, which are creams that you rub on the joints. We use oral anti-inflammatories. They just have a lot of side effects, and it's, you know, it's an adjunct, but, you know, a combination of different pain relievers, adjusting activity. One of the things that we want to do at Cape Fear Arthritis Care is work on a more integrated approach. We're going to have physical therapy, and helping people understand what's going on with the arthritis, and, you know, some education.
Education is so important.
Is so important, and it makes a big difference in if people understand it and are a part of the therapy. Then there's some empowerment there, and that makes a big difference as well.
So you mentioned physical therapy. You're going to have that on site?
Yes, we are. Lisa Schaefer's somebody I've known for a long time, and she's worked on some of her own techniques for physical therapy, and so we're going to have that available. And very excited about that. And hopefully as we get started, we'll bring some more things on board. Right now we're just excited to get the whole thing up and running and going.
Right. And now will you be open 5 days a week?
We're going to be open 5 days a week. We're going to have evening hours on Tuesday. We're going to do every other Saturday.
Oh, that's awesome.
Yeah, so a little bit more...
very patient
a little bit more
friendly.
A little bit more patient friendly. I think we think alike here. Yes, patient friendly. Our motto is where the patient comes first, and I think that sometimes in the modern healthcare, the patient is as much a commodity as anything else that goes on, and you know, we're moving away from that as a theme. And I hope we can. There's a lot of forces that make it difficult to do that, but I hope we're successful.
Well, that's great information. One other question: do you need a referral to see you?
As long as your insurance doesn't require a referral, we don't require a referral.
I see. So they don't need to get a referral from their primary care physician.
No, they can just call our office. Yeah, they can just call our office, and we'll set up an appointment. We'll try to make it as easy as possible.
Great.
Yeah.
And again, your practice is located in Delco?
Just outside of Delco.
Just outside of Delco.
27056 Andrew Jackson Highway East, Suite 2.
Suite 2.
You know, we're here to help.
Great. Well, it's been a pleasure having you on the show today.
Thank you, Jen.
Great, valuable information, and I know we've got viewers out there who will be giving you a call. We're all, you know, we're not getting any younger these days.
Yeah. Well, it's not just, wear and tear arthritis is more common as we get older, but lots of people have aches and pains.
Yeah. Well, great. Thanks again for being here. I look forward to hearing how everything's going.
Thank you. I'll let you know.
Good. Our final guest is Becky Whiteside, practice manager at Novant Health OBGYN. Well, welcome to the show today, Becky.
Thank you.
It's such a pleasure to have you here. And for those viewers who haven't seen you before, tell us a little bit about yourself and your background.
Well, I'm born and raised here. Have attained my Bachelor's of Science in Nursing from East Carolina University, and after getting my nursing degree, went into emergency nursing, where decided to go into quality and compliance after that, and then was interested in the administrative side and got my master's in healthcare administration, which brought me to this job.
Wow, that's great. You have a great background and more than qualified to do this job, I would think.
Thank you.
So let's talk about your new role. The role you were in last time you were here was in quality, and I believe now you're the practice manager at Novant Health OBGYN. Tell me a little bit about what you actually do at Novant Health OBGYN.
Well, we have 3 offices that oversee all the offices, deal directly with the physicians, getting them the information and services that they need, and then also personnel issues within the clinic, customer service, financial, budgeting, and then overseeing the clinic as a whole.
Do you arrange for their education and things like that also?
I do.
So you do all the in-house training and all that. You must be a very busy person.
I am.
Especially for three offices.
Yes.
Now, where are those offices located, Becky?
We have a main office. It's in Bolivia beside Novant Health Brunswick Medical Center. We have 2 other locations that were open limited amounts of times at. However, we do staff those accordingly, and those are in Leland at the Waterford Medical Center, and then also in Seatrail at Seatrail Medical Center.
Wow, that covers a lot of area here in Brunswick County, so it's really much more convenient for the women here now than it used to be.
Absolutely.
Yeah, that's great. Now, we've had several of the providers from Novant Health OBGYN on the show before, but let's remind our viewers who your providers are and at what locations they are.
Okay. All of the providers see patients at the Bolivia office. Dr. McCarthy, Tracy McCarthy, is our lead physician. She actually sees patients in all locations.
Really?
She does. And then we have Dr. Richard Toller. He sees patients in Leland and also in the Bolivia office. And then Dr. Lee Hsu, she sees patients in Leland and Bolivia as well. And then Sarah Brown is our nurse practitioner, and she sees patients in Leland and Bolivia.
They must work hard. They must not know where they are from day to day. They're just kind of all over the place.
Yes, they are.
Yeah.
We rotate through, make sure that we have enough coverage at all locations. And of course, with their call schedules, they stay busy.
Yeah, I bet they do. Well, today we wanted to specifically talk about the 3D ultrasound technology that's currently available in your office. Tell me how that differs from the previous ultrasound equipment that you had.
Previously, we had 2D ultrasound that actually is very limited for our patient. It only provides waves in one direction, which as a result provides a very flat image.
I see.
With a 3D ultrasound, it actually bounces waves in numerous directions at one time, giving a more lifelike image.
So it's more like a picture?
Yes, it is more like a picture, but it actually gives you the 3 dimensions of the facial structure, where the other one is basically just a flat.
Well, I don't quite understand how it works. You say it uses sound waves?
It does. The machine actually, ultrasound uses sound waves.
Right.
And what that does is a probe or a transducer is placed on the mother's belly, and those sound waves actually bounce through the abdomen wall, and then echo back.
Return.
And with a 3D, those waves are traveling in different angles. So it actually is nice to be able to see the full facial features. And it actually provides us with the availability to look further and see more detailed pictures to see maybe if there may be a birth defect or something like that, and more diagnostic
I can understand that.
capabilities. So.
Yeah. Tell me, is there an ideal time that an expectant mom would have that ultrasound done? I'm not sure when the child is large enough, or
Right. We can do them at any time for the most ideal pictures. If someone wanted to come in and just see their baby, we recommend between 26 and 30 weeks. That provides a large enough, developed enough fetus. And then also we don't want them to be too large, because as they grow, the space that they're living in becomes just enough to hold them. So we wouldn't want them directly up against the mom's uterus or anything like that. So there's enough space between that to get a good, clear image of the baby.
So
26 to 30 weeks is ideal.
Well, what if a family wants to come in earlier to determine like the sex of the baby?
We can still do those. We still actually photograph in 2D as well.
You
We
do
can
both?
do
Okay.
2D and 3D with the new machine. So we can see the sex of the baby. We usually do that around 20 weeks gestation. So that's actually nice. They can actually come in and have those pictures. And usually we try to also provide them with a 3D little image while they're there, even if they're at 20 weeks. But the best pictures of the face and stuff are usually from 26 to 30 weeks.
Is there any special preparation that the mother needs to do in order to have the ultrasound?
Not particularly. We do recommend that they are hydrated, but other than that, there's nothing special they need to do other than just make an appointment and showing up.
Well, how about bringing family members? What if everybody wants to come? Grandma and the brothers and sisters, can we do that?
We can. We do allow family members. Pretty lenient on the number of family members, as long as everyone can comfortably fit in the room and we're able to provide the needed care to the patient. That is our ultimate goal and our responsibility. So as long as we have the space for that, then we can. And we even allow them if they would like to switch out during the exam. The ultrasound room is right next to a hallway, so they can step out and then and rotate through if need be.
I'm curious, does insurance typically cover a 3D ultrasound?
Depending on the reason for the 3D, they do. Most insurance companies will cover it for diagnostic purposes. We are looking into doing non-diagnostic exams, basically just for families to be able to see their baby, to have a preview of what the baby will look like when they arrive. So in the purpose that it's a non-diagnostic, that is a flat fee that we would collect on the front end because insurance does not cover those.
How about pictures? Do you get to take away pictures when you leave?
We do. We usually try to give anywhere between 4 to 10 pictures, depending on the availability and good shots, of course, of the fetus. So we try to make sure that we do get a wide range of selection opportunities for the moms. So definitely we can get some pictures for the family.
Your patients, do they have to make a special appointment for the ultrasound, or is it typically during one of their visits?
We do require special ultrasound appointments
really?
for all of our patients. So all they would have to do is call the office, and we can set them up for their ultrasound appointment. Just let them know whether or not this is just a non-diagnostic test, just to see the baby. Then that will be different, because of course, if it's a diagnostic, we would need a physician order for that.
Oh yeah, I see. Well, that's great information. It's kind of foreign to me to see it in 3D, but I can see why folks would find that pretty interesting and want to have that special memento for that time period. So is there anything else that you'd like to share with our viewers? How about, are you taking appointments? Are you taking new patients?
We are taking new patients still, referrals of course, and then of course scheduling our current patients. Of course, we're always looking to grow and expand. We want to make sure that we're meeting the needs of the community and our patients. So as different things arrive, we're still doing in-office procedures. We're trying to expand that a little bit more. So hopefully we'll have something new to talk about in the near future.
Well, Becky, thanks so much for being on the show today. It was a pleasure to have you. I look forward to hearing more about these 3D ultrasounds, and you'll come back and see us again soon.
I sure will. Thank you for having me.
You're welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. For more information on Novant Health Brunswick Medical Center, local doctors, and general health information, please visit novanthealth.org. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.